I'm Bill Modzeleski, Associate Assistant Deputy Secretary at the Department of Education's Office of Safe and Drug-Free Schools. I want to thank you for the opportunity to appear before this committee today to provide you with an overview of the Department's actions during the 2009 H1N1 flu outbreak. This morning I want to provide an overview of the situation regarding school closings, summarize some basic principles that form the foundation of our response efforts, and if time permits, conclude with some of the actions we've taken recently to help schools and institutions of higher education to respond to the current outbreak of the H1N1 flu virus. Let me start by stating that the situation regarding schools remains somewhat fluid. That is, we have some schools opening while others remain closed. In the 8 school days we've collected information on school closings, we saw daily changes. On Monday, April 27th, 22 schools in 3 states had announced decisions to close for reasons related to the H1N1 flu. There were approximately 15,700 students impacted by those closings. By Tuesday of this week, the number of closures stood at 726, representing 24 states and the District of Columbia. And these closures affected approximately 468,000 students. On May 5th, the Centers for Disease Control and Prevention announced revised guidance on community mitigation that advised that students with flu symptoms stay home from school, that schools would confirm the suspected cases of the flu, not close. While it's been less than 48 hours since this revision was announced, we've already seen considerable change. Approximately 140 schools with 100,000 students reopened yesterday, and more are expected to reopen today. Overall, the school closures affected a relatively small number of students and staff, but created a considerable amount of concern. Although the scientists at CDC are cautiously optimistic about what they are learning about the virus, we must remain alert to the possibility that the nature of this current outbreak could change. We'll continue to rely on 5 key principles as we work to help schools and institutions of higher education prepare for and respond to the range of crises, including a pandemic. First, our chief concern will continue to be the health and safety of students, faculty, and staff. Federal education statutes and regulations should not be an impediment to closing schools for health reasons. We are ready to consider requests for waivers related to the flu to the extent of the Secretary's waiver authority. Next, we recognize that effectively managing crises such as the H1N1 flu outbreak requires many different agencies and organizations working together. The Department of Education can't do it alone. We'll continue to collaborate with our colleagues from the Department of Health and Human Services, including the Centers for Disease Control, the Department of Homeland Security, and other federal agencies to capitalize on the value expertise they possess. Working with them is also essential in ensuring that we provide a coordinated federal response. Next, we need to keep in mind that many of the most difficult decisions concerning response to the current flu virus must be made by state and local officials. While state and locals have a lot to do, a lot has already been done. States and localities, as well as the federal government, have already invested a significant amount of effort in planning for the pandemic flu. Every state has a pan-flu plan, and every plan contains an appendix describing the roles of schools during an epidemic. We'll continue to build on those planning efforts and support state and local education officials. Next, while the current outbreak of the H1N1 flu is the issue that brings me before the committee today, we believe that the best approach for schools and institutions of higher education to take in preparing for an outbreak of an infectious disease or any other crisis situation is to develop an all-hazards plan that addresses a variety of crises, from intruders and accidents to school shootings and the flu. Finally, our decisions about how schools and institutions of higher education are to deal with a crisis are based upon the fact that while crisis planning for schools has to consider the health and welfare of students and staff, the plan also needs to consider the educational needs of students. Crisis planning can't exist in a vacuum. Consistent with these general principles, we've taken several actions in the past week to support schools and institutions of higher education. In addition to tracking information about schools closures, we, in coordination with the Centers for Disease Control and Homeland Security, provided opportunities for school officials to hear up-to-date information directly from scientists at CDC and pose questions by hosting 3 conference calls. And I'm happy to say about 3,000 conference lines were used during those 3 calls. We also developed and posted detailed guidance responding to a number of issues specific concern to the schools and institutions of higher education, including school closures, and developed a mechanism for school and other officials to submit questions concerning the flu to the department. And we're using these questions to help us better understand the challenges that schools and colleges are facing to identify issues on which we can develop and post additional guidance. I hope that you found this overview helpful, and I'd be pleased to answer any other questions you may have.